All right, joining us tonight is Dr. Michael Levine from Columbia Presbyterian Hospital, one of the hospitals in Manhattan that is very affected by in the epicenter of the virus in terms of both cases and deaths. I must add that in the interest of full disclosure, Dr. Levine actually operated on my rotator cuff. He's an orthopedic surgeon, and I had occasion to speak with him, and I'm very thrilled that you're here tonight, Dr. Levine, to talk about how your world has changed and so many of the doctors under you as chair of the department, given your expertise and now what you're doing because of the coronavirus. Can you explain to my viewers how things have changed?
Well, Jeanine, thanks so much for having me on tonight. It's certainly a pleasure to be here. It's safe to say that the word unprecedented is probably the best word that we can all use. As an orthopedic surgeon, to be perfectly honest, we're no longer performing orthopedic surgery with the exception of emergency fractures. We've had to basically shut down all elective surgery of all types because of the COVID-19 pandemic. And so what our leadership at New York Presbyterian and Columbia University Medical Center have done is about 2 weeks ago, they asked all of us as chairs to come up with an emergency plan if our healthcare workers on the front lines in our emergency rooms and our intensive care units would be deployed to do other things. We would need to, as orthopedic surgeons, perhaps have to fill that gap. And that's, in fact, where we are. So that theoretical emergency state, or DEFCON 10, if you will, we reached. And so today, for the first time, 2 of my orthopedic surgery residents are working in the emergency room to help out our colleagues in the ER because of the depleted healthcare workers in the emergency room.
Well, it must be, especially for residents and doctors who are just beginning at your hospital, it must be rather strange for them to say, I trained for 8 years for this, and now I'm working in intensive care or I'm working in the emergency room. I mean, this is all voluntary, I assume. They realize that they're in a danger zone now, which is a little different than it used to be.
Well, there's no question, Jeanine, that that's exactly the situation. So this is about our calling as physicians, as nurse practitioners, as nurses, as respiratory therapists. Every single person right now in the healthcare system is basically saying we're all in. We're all going to do whatever we need to try to stamp out this pandemic, and most importantly, to take care of our patients, because at the end of the day, that's what it's all about. So you're right. Our residents really needed no encouragement whatsoever. They volunteered to do this, and as long as we have the appropriate personal protective equipment and we aren't putting ourselves directly in harm's way, then obviously I'm supporting that fully and supporting the New York Presbyterian initiative to do what we need to do to help our colleagues who are in desperate need right now in the emergency room for us as surgeons.
But then, doctor, do you have the equipment that you need, not just for your own physicians and nurse practitioners, but ventilators for the patients?
Well, I think you have to break that down into 2 questions, Jeanine. For the personal protective equipment, which is the N95 masks, surgical masks, gowns, and gloves, we're finally at a point where we're comfortable that we have that type of equipment and goggles. My chief resident, Eugene Zhang's brother-in-law, actually 3D printed face masks for all of our residents, and New York Presbyterian is likewise 3D printing face masks as well. So that part of it, I think we're in good shape. The ventilator question, as you have documented and everybody's been documenting, is a much bigger problem that is a national and international crisis that we're all facing. So we have right now almost, I think, somewhere over 1,300 inpatients in the New York Presbyterian system who are inpatients, and about 21% of those patients are in intensive care units. The entire third and fourth floor operating rooms at New York Presbyterian Columbia's campus have been converted to intensive care units, Jeanine. This is something that we've never seen, could never really have even imagined in any of our wildest dreams.
Well, but if you are in a position, doctor, where you have one ventilator for two patients, is that happening now? Are you jerry-rigging them?
Well, it's really important to understand that our folks at NYP, Columbia's campus, actually have been working on that, and that's been pretty well discussed in the media. But it's really important to understand that this is not something that you can look at a YouTube video and then do anywhere you want. This is extraordinarily complex, and at its best, it may add an additional 20 patients at each of our campuses. In other words, 10 ventilators might be able to, with the exact right patients and the exact right variables, be able to be jerry-rigged, as you said, to be able to ventilate two patients on one ventilator. So this will not be a panacea. This is not something that's going to solve the bigger crisis at all. And it's also something that cannot be done by anybody. You have to make sure you have your entire team working on this. And that's what they've been doing at my hospital. And even so, it's only been done on two patients so far.
Yeah, well, it could be, obviously, it could be a danger zone. But last question, and very quickly, doctor, are you on any kind of medication yourself, given the fact that some on your staff have actually gotten sick from this? I mean, this is worse than the Civil War, because in the Civil War, as bad as it was, and you didn't have everything you needed, you couldn't catch something from the patient. Now you can catch something from the patient.
Well, Jeanine, it's a great question, but I think it's really important that all of your viewers understand that there are really important guidelines that have been outlined by the CDC, and those guidelines do not include taking medication routinely. They do not include being tested routinely if you're asymptomatic. So I'm on no medications. I'm following our guidelines carefully and making sure that we're doing everything that we need to do to help protect ourselves and our patients.
All right. Dr. Levine, thanks so much for being with us. We appreciate everything you're doing. God bless you and your staff.